U.S. Health and Human Services Secretary Robert F. Kennedy Jr. and Secretary of State Marco Rubio released a joint statement, confirming that the United States has completed its withdrawal from the World Health Organization, WHO. This decision marks the first time the United States has not been part of the WHO, since it helped establish the organization in 1948. President Donald Trump first announced plans to leave the WHO in 2020, during his initial term. Over the past year, the U.S. carried out the withdrawal process by ending financial contributions, removing American personnel from the organization, and shifting health-related work previously done through the WHO toward direct partnerships with other countries and institutions.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year, and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China, saving untold numbers of lives. Thousands and thousands of people would have died.
Following the exit, the U.S. said it will only maintain limited contact with the WHO, strictly to finalize withdrawal-related matters. U.S. officials said the move responds to serious failures by the WHO during the COVID-19 pandemic and aims to address the harm those failures caused to Americans. They structured the withdrawal as the fulfillment of a commitment made to the public. The United States formally notified the WHO of its intention to withdraw in 2020.
What is this one? Withdrawing from the World Health Organization, sir?
Ooh, that's a big one.
Officials cited the organization's handling of the COVID-19 outbreak, which began in Wuhan, China, along with its response to other global health crises. The U.S. also pointed to the WHO's failure to implement needed reforms and its inability to operate independently from political pressure by member states. In addition, American officials criticized the WHO's funding structure. The administration argued that the WHO continued to demand payments from the United States that far exceeded those required of other countries. They highlighted China as an example, noting that despite having a population more than 3 times that of the U.S., China contributes significantly less to the organization.
We were paying $500 million a year, and China was paying $37 million a year. Back into it, you know what he paid? More than $500 million. I made a deal at 37. I could have had 37. They were public about it. We'll give you the same deal that China has for 37.
In their joint statement, Rubio and Kennedy said the United States has now freed itself from the organization's restrictions. A senior health official confirmed that the U.S. does not plan to remain involved as an observer and has no intention of rejoining. Instead, the government plans to work directly with other countries on disease monitoring and public health initiatives without relying on an international intermediary. In a separate video statement, Kennedy accused the WHO of drifting far from its original purpose, saying it has become weighed down by bureaucracy, conflicts of interest, and global power politics. Failures, he said, became painfully clear during the COVID-19 crisis. The Department of Health and Human Services confirmed that the U.S. has fully ended funding to the WHO. Officials said President Trump used his authority to halt future transfers of U.S. resources, arguing that the organization's failures during the pandemic cost the American economy trillions of dollars. U.S. officials also accused the WHO of delaying the declaration of a global public health emergency. During the early spread of COVID-19, losing valuable time as the virus expanded worldwide. They said, WHO leadership publicly praised China's response despite evidence of early underreporting, suppressed data, and delays in confirming human-to-human transmission. The organization also minimized the risk of asymptomatic spread and was slow to recognize airborne transmission. After the pandemic, U.S. officials said the WHO failed to carry out meaningful reforms to address governance issues, political influence, and coordination problems, further weakening trust. They also criticized the organization's investigation into the origins of COVID-19, noting China's refusal to provide key data related to early cases and laboratory safety.
Chinese officials ignored their reporting obligations to the World Health Organization and pressured the World Health Organization to mislead the world when the virus was first discovered by Chinese authorities.
According to the joint statement, U.S. leaders believe the WHO repeatedly acted against American interests and abandoned its core mission. Despite being a founding member and the organization's largest financial contributor for decades, the U.S. said the WHO pursued a politicized agenda influenced by countries hostile to American priorities. Officials said the organization delayed or withheld critical information that could have saved lives and later attempted to conceal its mistakes. The statement also described ongoing disputes, including the WHO's refusal to return the American flag that once flew at its headquarters, and claims that the U.S. still owes compensation. The HHS said the withdrawal seeks to correct long-standing grievances and end bureaucratic stagnation, conflicts of interest, and political interference within the organization. They said the decision honors Americans who died during the pandemic, businesses that collapsed under restrictions, and families affected by the crisis. U.S. officials further argued that despite heavy financial contributions, no American has ever served as WHO Director General. Meanwhile, WHO Director General Dr. Tedros Adhanom Ghebreyesus said earlier this month that he hopes the U.S. will reconsider its decision, calling the withdrawal harmful to both the United States and global health efforts.
I hope the U.S. will reconsider its decision and rejoin WHO. Withdrawal from WHO is a lose for the United States, and it's also a lose for the rest of the world.
Under a 1948 joint resolution, the U.S. retained the right to withdraw from the WHO with 1 year's notice, a requirement the Trump administration followed. While Congress had allocated funds to the organization through 2025, Trump's executive order directed the immediate end of U.S. payments. Government analysts later acknowledged uncertainty over whether outstanding dues were legally required, but the State Department said the U.S. will not make further payments, citing the high cost of the WHO's pandemic response failures. In response, the WHO said it regrets the U.S. decision and warned it could reduce global safety. The organization said the matter will be reviewed by its executive board and the World Health Assembly. WHO officials rejected claims that they acted in bad faith, saying they consistently sought respectful engagement with the United States. That's all for now from Global Pulse Unplugged. Stay sharp, stay informed, and we'll see you next time.